Yeah, you can. So, and from that point, a lot of new neurosurgical innovation start. Until that time, I've never found out new innovation in my job. In spite of I completed technical university and I completed medical school. The first innovation happened 25 years ago after my conversion. And that time, the main problem, one of the main problems in neurosurgery was the question of decompressive craniectomy after severe head brain injury. Because 1.5 million people died after severe head injury, and the main cause of death in 50% of patients was not the primary brain injury and the bleeding, but the brain swelling, which led the patient to death because of the incuneation and brain stem impaction, which caused breathing and circulation arrest. And the big debate started 120 years ago when the doctors, the surgeons started to use this procedure, the compressive craniectomy, but the results was not promising and was not good enough. The high mortality remained 80%, high mortality remained in spite of conservative treatment or surgical treatment. And the main problem was the bridging vein, which occluded immediately after the decompression, as you can see in the picture here. And immediate occlusion of the cortical veins and artery caused complex brain damage or complex cortical brain damage. So the method sank in the neurosurgical literature, and the method sank into the non-recommended category. In spite of yes, okay. In spite of this fact, a lot of neurosurgeons applied this procedure as in my practice, and at interesting case, 12-year-old girl who was admitted after severe brain injury. We experienced immediately severe brain swelling, but I don't know, because my colleague anesthesiologist facilitated me to do this procedure. I did this procedure, and during the procedure, I prayed, and the very simple, innovative surgical step got into my mind during the Jesus prayer, to put small pillars on the both sides of the vein, and by this way we could avoid the occlusion of the veins and arteries. And of course, this young girl stayed alive. And from that point, I started to examine this procedure scientifically. And after the first 33 cases, I experienced the enormous, huge mortality rate, 80%, reduced to 40 percentage. So from that point, I published it, but my experience was the scientific papers firstly don't want to accept absolutely logical procedure. They demand do prospective randomized trial. This is the main weapon of the evidence-based medicine. But I said to them, how is it possible to decide in the operating room and seeing the occlusion of the veins and arteries? Oh, I select this patient to the group, no surgery, and or to the group apply a vascular tunnel. It's impossible. I called in my prayers the help of God, and he advised me go to the dissecting room, to the autopsy room, and modelize procedure on the fresh cadavers. And I did it, and my publication was accepted. After the publication of fresh cadaver models, you can see here the models. And from that time, in the international neurosurgical literature, extremely high citation, we got extremely high citation nowadays, above the 200, and the procedure regularly was introduced into the brain injury guidelines, and this procedure can help us to graduate up again into the guidelines from that time. But I have it to God for the new innovation which got into my mind during the prayers. So my second innovation was an ultra microsurgical innovation. It was born 12 years ago. The problem was that the well-skilled brain microsurgeon or any field from microsurgery, the problem in a very thin vessels, microstructure, and the physiological tremor caused the problem and caused the insufficiency of microsurgical bypasses, and the physiological tremor originate in anybody like me, you, or you can see the small tremor, but it inhibits the precise work in 20 times magnification. And the problem was the during the microsuture, we support our instruments or hand on our palmar edge. And during this type of supporting, the joints between the end point and the last supporting line, last supporting point, there are joints which can transmit the physiological tremor towards the end of the micro instruments. And during my deep prayers, when I wanted to help the doctors, a very simple idea got into my mind. I called it fingertip support technique. You can see the method. It is the small bridge. When we, the last supporting point is a 1 and 2 finger, and between the last supporting point and the micro instrument top, There are no free carpal joints, no joints which can transmit the physiological tremor. This very simple method caused extremely better. Here you can see above the traditional technique, and here the fingertip support technique is 1 millimeter. So the tremor decreased under 0.1, 0.2 millimeter. It was also a very good idea. It was accepted after sending in the famous neurosurgical paper 3 days. 3 days. So I thank for God for this innovation. It is interesting picture in my spiritual life. 9 years ago, my son died after falling down into the basin, only 20 centimeter deep water during the athletics. And he died. But the deep of the water was only 20 centimeters. But it was fantastic. Very tragic event. Didn't reduce my trust in God, but increased my faith and increased my creativity. I had got mystic experience in Eucharist. The Eucharist very important in Catholic field. I don't know your religious, but now, Catholic is very important. And I got deeper to understand what does it mean, resurrection of body. And in spite of tragic events, my faith did not decrease, but it increased. And this lead new innovation in neurosurgery when I met with craniopagus twins in Dhaka Medical School during a neurosurgical mission in 2017. So it is a most difficult task in neurosurgery, and we have to know the main barrier of successful separation, not the brain separation, not division of crossing arteries, but the separation of common venous sinuses in the middle line, in sagittal line, between the things. To bypass these sinuses is often impossible, even if it's short, as happened in this tragic operation in Singapore. It happened in Singapore some years ago. Everybody was glad when, at the end of the 25-hour-long bypass procedure, the venous circulation in bypass seemed to be persistent after the vision. Half an hour later, the circulation stopped, but there was no brain swelling. The suspicion was confirmed. There was an unknown hidden common vein which had not persisted until that time. It was opened. The two patients died immediately after the 22-hour-long operation during the repeated bypass procedure. It was interesting because it was a over between very famous United States neurosurgeon Bert Carson, who started in president election in Republican Party, and the other very famous Singapore neurosurgeon. But the two girls at the age of 33 died tragically. It was a terrible morning in Iran. Our problem was the same, a very long circumferential and deep common veins. As you can see in this MRI picture, this was the cause that nobody had not accepted before the case for the operation. I said, seeing the MRI picture, of course, it is impossible to separation the twins. But I started the Jesus prayers, what I had learned 9 years ago in my tragical event when my son died. During my prayers, the inner voice said, take it away from both. But how it is possible, I asked the Lord. My scientific idea was, after the multiple balloon occlusion test, which we test during this test, we tested 24 bridging veins. It would be done if tests are negative. My world famous friend Stefan Hudak did it by 2-stage, 3 steps, 40 hours long operation. There were no neurological progression after the operation. Here you can see the result of endovascular procedure. The common vein disappeared practically, and we could start for the open surgery because it was, of course, an endovascular procedure. Here you can see the crossing neural pathway between the two colliculus was analyzed by tractography. We found it may be selective, may be cut. The skin expansion was performed in 40 short steps inflating after the implantation of the expander. For me, the separation of interdigitated gyri, which became narrow after losing the central spinal fluid. Important innovation was the hinge and the distractor to avoid the application of complex metal Mayfield structure, which would have inhibited the microsurgical movement. It's a very, very good innovation to open the skull by this very simple custom-made device. A lot of cadaver exercises we planned on fresh cadaver, more than 300, to rebuilding of the skull, to practice the division of the gyri, especially, and it was important, especially on the posterior part of the brain because of the supine position against nerves in microtraumas and any microtraumas. We practiced also on 3D and doll model a lot. And last evening, we could participate on a Catholic Mass in Dhaka, which is absolutely non-Christian population, but they appreciate us. And we could strengthen our soul by taking Eucharist, preparing to the extreme long operation. Thousands of people prayed for us and for the twins, hungry in Bangladesh and Nigeria, where we have another mission. The neurosurgical part of operation was 24 hours long. Here is some picture. And on the post-op CT, on the interdigitated side, increasing of venous bleeding was visible in one twins. You can see here the post-op days. Here is the hemorrhage, venous hemorrhage, but the left side remained intact. And on the 12th day, this twin started to move her both legs. On the 10th day, the life-threatening progression stopped. Another twin status was normal, Glasgow outcome 4 after 1 week. The tragedy occurred on 33rd post-op day. We planned this fashion of partial cranioplasty as we practiced in fresh cadaver and doll models. And because of the interdisciplinary misunderstanding, not those participants performed the procedure who practiced a lot, but the unpracticed colleague made the insufficient posterior protection was not enough against the normal microtraumatization originated from the nursing care, originated from the lying position, lying stooping position, where the posterior part of the brain immediately under the skin can suffer from microtraumas. And here we can see the extreme big bleeding on the left dominant side. Here you can see the non-sufficient posterior support, and here is terrible bleeding in the coronal view. But the intercessory prayers to Saint Charbel, Mother Teresa, Cardinal Vincent, who interceded for Jesus, helped us, and the girl stayed alive in spite of this non-acceptable bleeding for her life. The next miracle was 3 months after the huge bleeding, the brain damage relatively acceptable. You can see here, and the relatively early rehabilitation. The patient could not speak, could not understand because the dominant side bleeding, but she could stand with minimal assistance. She could eat, for example. So it is a question. It is questioning. Here you can see a picture after 1 year after the operation. One of them is okay, and the other one remained Glasgow outcome status 3. And I would like to start this very interesting film about the procedure, but I'm very sorry, but I don't know why it cannot start. It cannot accept by this computer. No, this was my presentation. Thank you for your exchange. I hope it was interesting, not only from the scientific point of view, but the religion point of view as well. Okay, who will be the next? Who will be the next? Vladimir Dmitrievich from Serbia. No, no here, no here. And the next, you are here. Oh, okay.
But maybe he's in another room or somewhere.
This is the neuroscience.
That's the news. That is not.
Okay,
They have to see people.
Yeah, but it's my
come here.
My PowerPoint is there. Or
Pardon?
my PowerPoint is ready. Or?
I
We can
hope
ask
so.
Krishna, that's
I
it.
hope so,
Yeah.
but you have to.
I have my.
You have to put in.
Yeah, I got flash. You have your flash?
I did it.
Yeah. That means we will finish in another 2 minutes.
Yes, I know. But I didn't.
We actually we see some of the people are used between in India and the other they're not
Yeah, I remember that one. I remember the 24th. You were young, no? But probably remember that. Yeah. So if we want to book appointment. Can I do the sharing and everything? And do the people on that they want to talk or anything? Maybe they can choose. Yes. Very clear. I do. But as I believe it's not recorded. I think the recording stopped. It's gonna come in. And no, no. Bismillah ar-Rahman ar-Rahim, the name of God, the most compassionate, the most merciful. I welcome you all in this Neuroscience conference, and obviously happy Ramadan to all human beings in this world. The title of my presentation is Fostering Creativity Using AI, Robotics, and Curriculum. After your presentation, we should be silent. But you can please feel free to contact me by 29jamali@gmail.com. Anytime I would be more than happy to answer any questions, especially regarding education. Talking about neuroscience and AI. Neuroscience has played very significant role in the history of artificial intelligence. And this complex relationship started in 1950s when, with two main approaches, neuroscience inspired AI. One, through emulating human intelligence, and the other one was building a neutral network that mimics brain structures. By 21st century, artificial intelligence was mainly used to solve human worldwide challenges. And obviously, one of the most important challenges was achieving long-term sustainability. What is sustainable development? We have limited resources in the world, so using this limited resources needed creative ways to solve. Yes, and because of the limited resources, we need creative innovations, creative solutions. So here we can see that sustainability and creativity are very closely related and interconnected. The Industrial Revolution also necessitates redesigning educational programs. So here we are talking about artificial intelligence and creativity. Then you can see the main approach in the world is creative AI system, is introducing creative artificial intelligence. However, my perspective was how to use artificial intelligence as a stimulus in education to develop creativity. What we need is creative human beings more than creative AI minds. What is creativity? Creativity means generating or producing something useful, original, and novel. I always use this cat's cradle in my presentations. Creative climate. This is a model introduced by Kim, 2011, to foster creativity. We need creative climate. That could be a home, that could be a school, that could be, as we saw in Corona time, it was corner of a house or even down the stairs. Creative attitudes means creative behaviors by parents, by teachers. An environment that a student or a child doesn't feel threatened by in giving up by new ideas and creative solutions. And if we have these two, we're going to have creative thinking skills. Now we are talking about artificial intelligence and how does it foster creativity. To do so, I would like to do a very basic presentation about creative thinking skills. I believe that education neuroscience and one should focus primarily on education. Why? Because future challenges that the whole world gonna face, it's actually its current educational dilemma. If we develop creativity and in our children and our students, in future we're going to have much less program in solving the worldwide problems. So what are creative thinking skills? In short, we have named 4 creative thinking skills. Fluency is generating many ideas. Flexibility generating different. So when we talk about fluency, for example, when we talk about many ideas, we insist that there is no right and wrong. You can see as many ideas as you want, even if they sound funny or if they sound silly. But if you have to allow your mind, you give the permission to your mind to generate ideas as possible, as many number as can do. Flexibility is generating different ideas, different kinds. Originality, which very rare in this world, is unusual ideas. And we have elaboration, is adding and work, adding details and adding ideas on the main project. So I put them in the color, so hopefully it stays in mind for a bit longer. And for artificial intelligence, in my school, I used Arduino. Arduino, if you can see, is a software, which are wires and everything, and the hardware, and the software is this chip, and we can use the very simple version of C++ code. So what does it do? Take information, analyze it, and produce it. in doing research on artificial intelligence in education and creativity, unfortunately, the amount of research done are very few. Hopefully, this will encourage some researchers to do more research on Arduino, on artificial intelligence in education. It's a very neglected area. And one of the reasons is that it's teachers that are crowded by curriculum and the exams and very standardized tests. These are some of the research I found. The main limitations with these research was the sample was very small. The sample is usually 6, 10, like this. The environment is very controlled. The II or robotic curriculum is very intense. As I said, it's a very short period. The focus is on quantitative method, while qualitative method is greatly neglected. And unfortunately, I don't know why, it's not representative of female gender. And they don't examine the whole creative thinking skills. They use non-standardized tests, and mainly they lack theory and reasoning. And one of the reasons could be because the people who do AI research, they are not teachers. So usually they are AI coach. What I've done this, the method in my school. The research design was a mixed method. So I've done quantitative using the creative assessment pack. And I've done interviews and observations because I'm a teacher and I am an AI coach. So there is a random sample of 60 female students. They engaged in this research. I give them an artificial intelligence intervention for one session of 2 hours for a duration of 10 weeks. That's the whole semester. And I analyze the data. Here, I use my model. This is the model I come up with it. I made it in 2022. It's called Jamali MC model, meaningful and creative learning. In this model, because my area specialties are in gifted and talented students, so I focus on creativity. Creative and meaningful learning, according to this model, has 5 characteristics. It should be active, constructive, authentic, cooperative, and intentional. And if we do this properly, we could come up and we could foster creative thinking skills in each, according to each characteristic. What I've done, I use artificial intelligence as a core. That's the intervention program. And then I applied this characteristic and see how can it really develop thinking skills or not. And we just came up with a very interesting results. The first one was active. Active learning denotes activities involving students in doing things and thinking about what they are doing. It has positive influence on learners, and then there's new knowledge and develop new skills. Here, I'd like to focus on CES because of artificial intelligence. Some of the research, they just do the application, the software, and they teach students on how to do it on the computer. They don't involve them physically with Arduino or Raspberry or other stuff. Learning should be active if we are expecting to develop anything creativity. So the thinking skills that will develop here is fluency. Let's see the example. Yes, here there is an example of a smart garden, artificial intelligence garden. And the result from quantitative data indicated significant increase in the thinking skills of fluency in the pre and post test. And obviously in the treatment group, the control group that we didn't do any intervention with. When I ask students, okay, tell me about your product, what you do, what is the missions this AI robotics can do. One of the students here, I have Jude, he said that they built this program and that the artificial intelligence can do numerous missions, that is the number of missions. So here the code, the program could provide data regarding the soil pH, soil moisture, soil temperature, air temperature, humidity, and so on and so forth. You can see many skills are developing. That is what that is learned. The other characteristics is constructive. Constructive activities invite learners to reflect. When they start to reflect on their thoughts and deeds, they have this old mental models and they have new information and new skills. So their mental models become more complex and it results in creative meaning making. So they have something from before and something new and they have to merge it somehow to learn new information. The creative thinking skills here that we can foster is fluency and flexibility. So I always tell my teachers I train or the people coming, my trainers, that when you teach your staff constructive activities, make sure if you can see flexibility and fluency coming, being developed. If not, there is something wrong. The flexibility skills here, if you can see from the picture, because I did Lego robotics, my students. So they know about Lego robotics. The Lego robotics, if you're not familiar with, is about Bluetooth. So it's coding, but it's not internet. It's used Bluetooth mainly and drag and drop coding. So now my student here is Kofar. Kofar started to merge AI with the Lego robotics. So we have the robot that she made, and she used the sensors and the motors from Arduino and merged that to Lego robotics. So now we have this the new robots who work with internet, and we can able to code them and program them. So you can see the fluency of the flexibility of mind, merging merging old with the new, and obviously the quantitative data also showed a significant. The other one was cooperative. We talk about cooperative, but we in some nations we don't believe in it. So we start from Japanese and Chinese who are very hard teamwork. They have very hard teamwork, and we move to Gulf and going to America, and it will increase the amount of cooperative and team building as it moves. So in our school, we talk about cooperative, and we started to do AI as a team. And because the things was new to them, they really enjoyed working as a team and taking ideas from each other. The creative learning skills that we developed was fluency and flexibility. More importantly, was elaboration. So adding data. They start to share thoughts, listening to each other and work together to accomplish the task. We had this elaboration, the quantitative part, again, we saw significant increase. Observation and the qualitative part was interesting. They developed this model that I will talk about it later. But the interesting part that it had 18 components. And even if you search on YouTube or anything about AI projects, they usually have 5, 6. So 18 components was very interesting for me as an AI coach. The other characteristics in this being intentional. All what we do in the life is toward achieving a goal. Sometimes the goal is very basic, making somebody laugh, and sometimes it's more complicated, such as entering a new profession. Intentional learning requires time management, self-regulation, self-discipline, and 21st century skills. Learners, to my I would always tell my trainers, learners should get involved in competitions locally and internationally. They should know what is going on, and then it will help them and drive them to make unusual ideas and interesting ideas. And creative thinking skills, here is originality. When I was doing Lego robotics before, I couldn't be able to develop originality. It was really, really hard. Maybe because of the limits Lego robotics has. But in AI, I was fascinated how AI helps them to do so. This is an example of one of my students taking part in expo exhibition. The idea was the idea the student came up with is a baby car seat, and we put baby in the car seat. And when at the mom we start to drive, the only thing we care about is the crying baby in the car seat. So this Arduino, where they programmers, they started to analyze the baby cry by seeing the vibration, low vibration and high vibration. If the vibration was low, they would play a music, soft music, and if the vibration of the cry was loud, they will move the toys. So for me, it was really interesting. The basic innovation, maybe in the future they can be like our surgeon. And when I asked why you could be able to work like that, they said it has, you have many sensors. We can do whatever we want to do, and it's very it's much easier to do unusual ideas. And believe me, if we give opportunity for the students, young generation, they can come up with all the solutions. The last one is authentic. Authentic activities enable learners to bring their knowledge and skills into life. Here, we want to make it more realistic so they can generate and apply their learning and deepen their understanding. By authentic learning, students start to absorb new knowledge and strengthen the link between what is learned and future content and problems. So they can apply these skills in it. Creative thinking skills here is creative problem solving, which includes all other thinking skills we talked about. And a very interesting example is this is a page of the magazine that they published by my students. Zainab and Amal, they come up with the product Smart Cap for students with asthma problems. Because during the corona, the main one of the very challenges they faced was students with asthma problems that they couldn't come up with food. So they create this cap, and can you see in the top that has two eyes. So if people came close to them, it would warn them with the sound of their sound that please keep the social distance. And the tube you can see, they said we have asthma problem. What we don't want other people to see we spray. So they came up with the tube, the spray inside the big ears, and if they cough 3 times in a row, it would ask them to, do you want to spray? And they will say yes, and it's spray. And the blue lines on the side, that is screen, LD screen. And LD screen, after here's the cough, they would tell them, please see the app. So the app itself, there was an application on the phone that Amal did it. The application showed them the places, the location of health center and other places they can refer to when they have severe problems. You can see we have fluency, many ideas involving. We have flexibility, different ideas getting together. We have originality, unusual ideas being fostered. And we have elaboration. This is the one with 18 components. I have the video of that, but it's Arabic. Oh, you're interesting. That's good. That's the table of the results. And you see on the corner, they're all significant. And I was fascinated at I didn't expect that to happen. But there are students that are willing to know and willing to learn more and more. My recommendations would be for policymakers and to prepare training opportunities in AI, in artificial intelligence, to teachers and to all members of the staff. They should fund the large scale studies and longitudinal studies. We want to know more and more. And they should consider integrating artificial intelligence in curriculum. And because of the artificial intelligence, such as Arduino Cat, they have a lot of bugs, and there are many things that are not right. So I do recommend manufacturers to consider resolving these bugs with Arduino hardware and providing easy and applicable AI in education purposes. Here's some of my references and some of my publications. The last one came up 2 weeks ago in London. It's developing creativity via Lego and AI robotics. Thank you very much. And I see if I can show them the, show you the. What is the age? Yeah, what do you expect? Yeah, what's the age? How old? What do you expect? What are the 14? Yeah. All the research are 14.
14.
No, my
were
research is 10 to
10.
12.
10 to 12.
10 to 12 years old.
So that's, I think it's early.
It's very early, but they can do it. I get a lot of support in the school, but in the beginning, they will say, why? They're not going to learn. It's difficult, but if you give them little by little, step spoon by spoon, that's why I'm talking about very long period for intervention. If I want to apply AI, you have to start step by step, spoon by spoon, very small spoon at a time. They will understand it.
So they like,
They love it.
they love it.
Yeah. But they have to understand. Maybe something goes wrong. Maybe like this. But they want to learn. They like digital learning, and anything goes with the computer. And because I was expecting them to run away and say, it's difficult, we don't want to go. But no, they like it. They like it.
10 years.
They are great in primary school. They are grade 4 till 6.
So, for grade 4, of specific AI calculation.
Yes.
And then when they reach 5, there's an little advanced or how?
No, what I do, I'm a specialist in gifted education. In Bahrain, we have a specialist like me in a school. So we do the intelligent test and creativity test and other stuff with the students at the age of 10. So I will pick up 20 students from grade 4, 20 from grade 5, 20 from grade 6. And I will continue with this 3 years. So they are my students. I meet them once daily in a weekly. I will teach them about it. I start Lego with grade 4, and then grade 5 and 6, I give Arduino. I give artificial intelligence.
So how do you evaluate their progress?
I have the creativity test, which is a Renzulli test, and Williams test. So I give them tests, and then at the end of the program, I give them another test and see the progress of their creativity. You know, when they saw some of my students, they they are doing university artificial intelligence. And
Are there schools?
we have artificial intelligence in our in master degrees. Yes. Baccalaureate, no, not yet. Maybe networking for yeah. Mm-mm. Yeah.
And you give these experimental models to students and collective.
Yes. I teach them. This one, my students, I do that teach them. I also train teachers. And in my conferences, I teach them about this Jamali model. And I say, make sure you do up your yeah, this is the creative and meaningful learning. I published this in London last year. I think it's very interesting area, and by the the importance of creativity is just getting more and more.
The neuro neuroanatomic neurophysiological because our inner that in our limbic system, remembering depends on hippocampus structure because our cortical network can accept all of the information from the brain because a lot of that in every cells have corticals and then dendrites. But in our inner world, the number of the network is more or less than our cortical surface, and the process of remembering is I have to remember a lot of similar education and a lot of studies relatively fast. But I can remember only those information which was stemmed by the emotional inner world, the cells which exist there. And the number of the cells in hippocampus for inner world is very few compared to cortical cells. And this is why the brain science very strongly recommend from the childhood the art to do art, literature, and music, which can improve
The creativity.
our inner world. So
Very interesting. Very interesting.
you know this
Yes, I
concept,
read
you
some
know this
articles, yeah,
concept.
about this. And especially creativity, before they use it, they would say it's connected to one side of brain only, their left or right hand. Now they know it's both. And it's AI means we are talking about creativity, about creative scientific things.
But this connection to the science was most simple group to grow up in the world. It was a class.
Yes, of course. You always use it to go shortcuts to God. Okay, I'm trying to find the video. I'm sure I had it. The next one, you want to have break or anything?
Next week, we will the next.
I think we have a photo.
We have a photo. Yes, you can. You can. Yeah, you can. Yeah, go ahead. Yeah. Yeah. That, yeah.
Yeah.
Great.
Thank you very much. I would like to thank you all for today. It's a great honor for me to be here and to see you guys. It's my first international conference. I think it's interesting that we can talk to each other about the experience. Thank you so much for sharing your experience with me. It's my research is like, it's not as big as the other one. It's like a case report. Me and my colleagues in Syria, in Aleppo University Hospital, we have a very interesting case, and we decided to write it down and put it in publication. The title of the case report is Primary Cerebral Venous Thrombosis in a Patient with Immune Thrombocytopenia Purpura. The head of department was the Dr. Barfuti, and me and my colleagues, Mike and George Romier, we are both interns in the Department of Internal Medicine in Aleppo University Hospital. I would like, this is a quick reminder of the quality of evidence pyramid. We know the basic is the background information and expert opinion. And then case series and case reports, it's like the case we have written. And when we get higher, the quality of the evidence gets better, and get the most powerful information is the filtered information, systematic review and meta-analysis. It's like they take the cases and the studies and filter the information and get new results from it. Okay. Why we published this case report? Because it was an unexpected association between diseases and symptoms, and it was unexpected event in a course observing or treating the patient. And this was a new possible pathogenesis of the disease. Okay. This is the case report. It was published in Hindawi case reports in neurological medicine, and it was published in 19 August last year. And I would like to talk the background about the disease. An ITP disease is immune thrombocytopenia purpura, is an acquired autoimmune hematological disease. It is characterized by antibody-mediated platelets destruction causing thrombocytopenia. The symptoms can widely diverse. It can completely asymptomatic, or it can express in a lethal bleeding or an intracranial hemorrhage, especially during severe thrombocytopenia. It depends on the platelets number, of the platelets count in the blood. The main treatment of the ITP includes corticosteroids, intravenous IVIGs, thrombopoietin receptor agonists, and if all of this medicine is not working, we can try for splenectomy. And
once again, the symptoms, the treatment of the disease, it's always connected with the symptoms and with the platelet count. Cerebral venous thrombosis is a relatively uncommon but serious condition that occurs mostly in the presence of hypercoagulable state, which has several causes, include pregnancy, inherited or acquired thrombophilia, infection, and malignancy. Clinical manifestations include confusion, altered mental state, a focal or generalized seizure, focal neurological deficit, and signs of increased intracranial pressure, such as severe headache or papillar edema. Mainstay of the management of CVT is anticoagulation, as well as the management of the underlying cause. To know why the patient had this CVT and to manage it with anticoagulation. And now bleeding and thrombosis it's a paradoxical etiology, and the association between two of them is extremely rare. However, in our study, we present the case of a young female who developed these two disorders together. The case presentation. A 19-year-old Caucasian female was presented in our emergency department with a chief complaint of 2-day history of severe bilateral non-pulsating headache and blurred vision. The patient experienced a generalized tonic-clonic episode in our emergency department. Thus, diazepam 10 milligram was given twice and followed by 15 phenytoin. Her seizures were controlled and she was admitted to the intensive care unit. The past medical history was significant for recurrent episodes of epistaxis and purpura that started a year before this current presentation. Routine workups revealed the presence of severe thrombocytopenia, while the other lab tests were all in normal limits. And another screening for HIV, HPV were also negative. A blood smear revealed isolated thrombocytopenia. Bone marrow biopsy revealed an increase in the size and count of megakaryocytes. Past surgical, family, and social history was unremarkable. She was sexually inactive and does not use oral contraceptive pills or any other medication. Unfortunately, antiplatelet antibody test was unavailable in our country. So therefore, the patient was diagnosed with ITP by ruling out all other possible causes for this thrombocytopenia. Prednisolone was started and continued regularly until presentation. On the follow-up, she was always demonstrating fluctuating response. However, symptoms have recurred. Physical and neurological exams were all normal except for a positive bilateral Babinski signs, and there were no focal signs. Laboratory workups was unremarkable except for severe thrombocytopenia. Brain CT scan was normal. Fundoscopy revealed bilateral papillar edema. And by the MRV was performed and demonstrated occlusion of the sagittal, supratentorial, and left transverse occipital sinuses that are consistent with CVT. And here is the photo of the MRV. So we can see the occlusion in the white area. After the CVT diagnosis in the ICU, the patient was given levetiracetam. 500 milligram was started. We could not start the optimal treatment with warfarin because of the high risk of intracranial bleeding and the low platelet count. And it was recommended to use the enoxaparin, 1 milligram per kilogram, was administered. Unfortunately, IVIG is not available in our country for the treatment of the thrombocytopenia. In the following days, the patient's state improved significantly. On the 7th day, the patient's platelets stabilized above 100 and her neurological symptoms improved obviously. Thus, warfarin was initiated instead of enoxaparin with close monitoring. On the 10th day, she was neurologically intact without any abnormal neurological signs or symptoms. However, her thrombocytopenia has recurred. Unfortunately, CD20 inhibitors and thrombopoietin receptors are not available in our country, so we did the splenectomy, was performed, and her post-operative follow-up for 6 months was normal, and her platelet count was stabilized. But why performing the splenectomy? Platelet destruction. The primary site of platelet destruction is the spleen. The prominent role of splenic clearance explains the effectiveness of splenectomy in most patients. But sometimes the clearance may occur in other tissues, as well as such as the liver, bone marrow, lymph nodes, and accessory splenic tissue. That may explain why the ITP can persist and recur post-splenectomy. ITP is diagnosis of exclusion that made in patient with isolated thrombocytopenia. That means that the patient has no other symptoms, nothing, just this thrombocytopenia, low platelet count, and the pathogenesis of ITP is incompletely understood. They may be, the causes of this is maybe an inciting event, genetic or acquired factors may contribute, or a secondary ITP include a number of chronic disorders or infectious disease, autoimmune disorders or infections, TMV, HIV infection, hepatitis B or hepatitis. Hypotheses that explain the thrombotic event in an ITP patient. An association with the disease etiology, the elevated level of antiphospholipid antibodies and platelet microparticles in patients with ITP may explain this thrombotic event. An association with the treatment, as almost all the agents used in the management of ITP play a role in the occurrence of thrombotic phenomena. That maybe we could think that the ITP, we should think of it that it's not just a high-risk bleeding patient. It is you can also think of it as it maybe occur as a risk factor of thrombotic event. The treatment of ITP, IVIGs, thrombopoietin receptors agonists may increase the risk of thrombosis, and corticosteroids may contribute somehow in the hypercoagulable state. Additional risk factor for thrombotic events. Some patients develop thrombotic event just after splenectomy that can be explained with the rebound elevation of platelet level. When it's so low and in a small period of time, they get so high, and this rebound may cause thrombotic event. Other risk factors such as age, obesity, smoking, hypertension, diabetes, dyslipidemia, or oral contraceptive. The presence of ITP and its treatment should be considered as a risk factor for thromboembolic events. The taking-home message: the association between ITP and CVT has carried a major challenge to the treatment plan for the patient. And in conclusion, we believe that ITP and ITP treatment methods should be taken into consideration as a risk factor for the thrombotic events. And here are our references. I would like to thank you so much for your attention. Thank you. Do you have any questions or?
These patients?
No, she was 19-year-old. She had no past medical history. She had only this ITP. And when a patient with ITP, you always think of bleeding. The patient may bleed. The patient may have purpuras, may have problems bleeding, epistaxis, and then all of a sudden she had this thrombosis, and you think, wow, we should think about thrombosis too when with these patients, and we should take under consideration that with these patients, it's like the risk factor for thrombosis is also important. That is the main message from our. Thank you so much. Thank you.
I think 11:20 is network refreshment. I don't know whether the water is steady.
Yeah.
We can continue also the refreshment.
Yeah.
It's too early
We
for
stay
lunch now. I
ourselves.
think they will serve lunch there at 12, at maybe 11. Lunch break is 12:50.
Well, okay.
Yeah, okay. It takes buffet lunch, so it's not going to be ready now. So just help me.
Refreshment.
Refreshment.
We'll take a break.
Yes.
Yeah.
Okay. You want to add in?
Wonderful. Thank you.
So you are here. They send me there
Oh.
instead of here.
You are supposed to be here.
Yes, of course. That's me.
The second
Oh,
one.
we are waiting for
We
you.
were
Yes,
waiting.
yes. I'm sorry, but they send me next this.
So what's going on next room?
Yes, next room.
What are they
What is
talking?
I will give you now to.
What are they talking? Next to what topic?
I told you to my friend. I was sitting next to the Chinese professor, and we talked.
Okay.
Yesterday, I was with my girlfriend from Serbia. She is 20 years in London. She told me Britain is awful. So I'm not surprised.
Think of
That
right
they-
away. Understand.
But we are not awful.
They are not awful.
This room is not awful.
Where can I sit?
Please, yeah, yes.
Here. Now I will give you to.
You can give me up.
Yes,
Yes, please.
Just a moment.
I'm not organizer, I'm just another
Yeah,
speaker.
please.
None of the
But
But
the
helping us.
problem is that Kevin Peter sent me message. Now I looked at email that it is here, not in that.
Oh, it's the name.
It's Trafalgar's Blue.
Oh, that's the
Yes,
sweet.
he sent me email that it is here.
We didn't read
Oh,
even
yeah.
though.
All the messages I get.
No, it's a post now. Now it's a post. After that, I will.
Yeah.
Very nice to have you here.
No, but now I have looked everything that this is Trafalgar suit, and I asked this gentleman who sent me there. I said I have to be here, not there.
It's fortunate you did not present.
Could you not present here? Which one is that?
First, no. Let me see. Yeah,
Yeah, first.
toxicology. Yes.
Toxicology. Okay, already.
So you given another lecture than that. Yeah, no, this will be a lecture about something that is excellent for oncology, brain disorder, cardiology, toxicology. Americans are sending me in the whole world to give present of the conference and to be planner lector. Everywhere are sending me Americans.
Yeah, I already
Okay,
opened it.
okay.
I just have some refreshment.
Sorry.
Sorry. Have some refreshment.
Yes,
Ready,
yes.
already. I'm just looking for something
And
for
no, at the end, there is a presentation of 2 minutes, American presentation. Go to
just
see the, yes, go.
One minute.
Go. This will be 40 minutes. So,
Yeah, no problem.
Yeah, and this.
one. Let's double check the words,
yes,
no?
here. It's working. Okay. Excellent. Excellent. It's working. You will hear American
Yeah.
priority of life.
What to do?
2 minutes.
Okay.
Presentation. Yes.
I put on the first slide now, no?
Yes.
And the refreshment of how long? 20 minutes?
40.
Okay.
It's written
Yeah.
40.
No, I mean, you can just have some drink and copy this stuff.
Yeah,
10 minutes like that.
Yes, I have a copy there.
Oh, yeah.
I will now take
Check my,
now.
yeah, it's done. But I want to see if I can go into. Oh,
Oh, no. Sorry.
if you want to put it on the screen, it's okay.
Okay.
Should
Take a copy.
It is here actually.
There is a recording.
I stop recording. No, I don't stop. I don't know what's going on. So, actually I wanted to go to the other room. Didn't give me chances.
Yeah, well,
Is it still necessary to be here?
Uh-huh.
Okay.
You people just take the break.
We just started, yeah.
Yeah, okay. Are these your certificates?
Give me this paper, neurology. And brain.
Yeah.
Excuse me, Christian. Who will give us that? What is that? They just give it to me. Oh, please. Just we give it away like this? No.
What's your name?
Okay, you will. That's okay. Sit down with somebody else.
I have no idea. Yes, yes. Just to know, I respect it very much.
Hey. Yeah.
So what were you doing in the other room? What was the part?
Natural science about,
Biology.
I will tell you, it is called Nanoscience and Nanotechnology Congress. And this Barcelona calls me next year.
Next.
Yes, and Rome also calls me next year. And this year I have to be twice in Dubai, twice in Japan.
Dubai is next door.
Yeah,
Yes.
so come over here.
You
From Bahrain.
from Bahrain.
Yeah.
I go to Dubai twice, then I have to go to Japan twice, then I have to Mauritius to go, then to go to somewhere else. Yes, I was in Portugal, I was in Rome, then I have to go twice in Rome.
Very good.
So-
very good.
But that's American. They are sending invitations.
very
They are sending invitations.
So, you have coffee after?
I have coffee. I have coffee.
No, no, you can go.
Now,
Yes, they said also for them that first coffee and all these things, and then they will take the photo. Yeah, they told. You are from Japan, yeah?
Oh, yes.
I have to be twice in Osaka.
Oh, you're right.
Yes.
Good.
And one colleague that was with me in Portugal, he told me that he will come in Osaka in June when I'm in.
Huh?
He was Osaka.
June in Japan is the rainy season.
Rainy
Hot and
season.
humid.
Ah. You see how it's in London.
Yes. But today is nice.
Yes, yes, yes.
The program is in Tekla.
I will give you this, what I have presentation, I will give you this in English. Flyers.
Thank you.
There biochar biodihydroquercetin about what I will speak, and then there is the soap and one serum for which is excellent. They are all from chaga. Here. No, two different things. Different.
Okay.
This is all is from chaga. Excellent, excellent. The whole world is asking me. It is registered in America, in the European Union, so it's not a problem.
So they said they would distribute the certificate at the end of the day. I think somebody will come and give us the certificate. And the group photo will go. The group photo will
Is it now?
no. They're gonna take it.
Oh,
But just double check everybody here, because some people are missing. You find your certificate. Okay.
Yeah,
Yeah.
refund.
That's nice, not here. One is not.
So where can I get this soap?
Hmm?
Where can I get it?
I will, when I come to Japan, I will bring it. Yes, 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 yes.
is that a website for that? What is that? Thank you so much.
This is excellent. And all people that have cancers in Serbia asked me for chaga and dihydroquercetin because after 6 months of extremely normal using of it, in 6 months you don't have cancer.
Wow. You know, the rate of cancer in Bahrain is
Here
actually
is for
great.
you.
Yeah, thank you very
Chaga
much.
and dihydroquercetin and soap and
And how can we get it? Is it on the Amazon or in?
no, it is registered. It is registered in USA and in the European Union, but you have to find somebody who will register it,
Exactly.
and then I will send you emails
All right. Very
on
good.
email presentations in English that I got from Russia, and then you can or somebody has to register this, and then you will get this.
Okay.
It is free.
This is free, but it's not expensive. Chaga and dihydroquercetin are powers. It's not nothing like drugs or something like that. It's powder, and it is those two. Dihydroquercetin is 180 dose. Chaga is 100 dose. Dihydroquercetin 180 dose. They are 110 euros altogether.
110. Can we buy it from England?
No. England is.
It
I told you.
has changed actually.
Yes, yes,
We
yes.
did before it wasn't like
No. In England you can't find it. If somebody registers, then you can find it, but nobody. I told you that my ex-girlfriend told me
yeah.
England. She's 20 years in bank here in London.
Yeah.
She,
It has
I
crashed.
meet her last afternoon, and then I will see her in 2 days later, and I said, "How is in England?" She said, "Awful."
10 years ago, no, 2013,
Yeah.
I studied here. My master.
I was here 1 year in London School of Hygiene and
See,
Tropical
it was
Medicine,
good. Now I
but
don't know what's
I
going on.
finished master degree in my town, not in England. They didn't want to give me master degree.
Really. I finished.
And it was 1987 to 1988, London School of Hygiene and Tropical Medicine. They said no.
Really.
And then I go and finished it in my town.
Much. Very
So I know who are they.
interesting. Yeah. What lack of organization? We didn't see this before.
I came here because I like London, like a city.
Yeah.
Because I was 1 year, so I know everything here. And there was one congress here, and 3 times I was here because there are 2 congresses here, transfusion medicine and some of another specification. So, and now I'm here again, and I got 2 years visa for England, so I will come next year and the 3rd year.
Yeah, and you have friends, your friend here.
Yes. Because London is perfect. London is
Yeah,
beautiful,
it's
but
for shopping.
yes, for everything, for everything.
And
But somehow it's Brooklyn. It's not like before.
Huh.
Yeah. Like our parents studied in London. Like back then in Bahrain, whoever wants to continue studies would come here. But now they don't anymore.
I will tell you that those who present future told one French, one Vanga from Macedonia, she finished in Bulgaria, and one Serbian, they said that Europe, England, and America will be very bad. They said it will disappear, but not disappear, but it will be very bad. Maybe next. Now, you don't know how situation is in Germany, how situation is in London, in England. Very bad situation. In America, very bad. They said Russia, China, this right part of the world will stay.
yeah,
European Union, England, and
such a
America,
shame. Yeah, they'll vanish. Such a shame.
and they are in very bad situation now. In very bad situation. Germany is in extremely bad situation. Then England is not in good situation. Yesterday, when I was in center of London, a lot of shops are closed. And I was surprised because when it was 1987, 88, so it was 40 years ago. So it was perfect. Not the school, not the London School of Hygiene and Tropical Medicine, but the city. The city was very beautiful and everything was working and everything.
Maybe it will come you to the university. But
Need a good man.
yeah, good
Huh.
management.
When I was in Portugal, I bought for my daughter one excellent T-shirt and one some good thing for me and my son, and they were surprised because everything was in center of Portugal in Lisbon. It was 20 in H&M. It was 20 euros. When I came in Serbia, they said, Radimir, this is 50 euros or 60 euros in Serbian, and it's not. It doesn't exist in Serbia. There is H&M in my town, but it doesn't exist at all. What I bought, but daughter and son, they were surprised how it was nice. 20 euros. Center of Lisbon, because I was at Congress 8 years ago. So when I was in Lisbon, I visited all what I visited 8 years ago. And I asked people, I was in the same hotel in center of Lisbon, and I asked them, is H&M still here? They said, yes, where it was, it is still there. And then I was in H&M, and I bought 3 things for 60 euros. Perfect thing.
So the carrot is down.
Hmm.
They said actually, the second strongest currency is Bahrain currency.